Good morning. Thank you for letting me come here and speak. Dr. Micheli, Dr. Coker. That was great, Greg, the information you just presented. So when they first came to me and asked what I'd like to do, I went back and forth with Greg via email and texting. And what we decided to do was we really think that the evaluative tool that he uses to assess how a person can be evaluated in terms of their valgus of their knee and if they have a predictor. So I brought a top-notch model to my daughter, Sophia, to come up afterwards, and Greg's going to go through and just kind of point it out to you. Because I think that the programs themselves of ACL prevention, and I'm going to just name a few in the next few moments, I think most people have a pretty good grasp on the different programs. I think Greg's paper on the 14 different papers that you can read really demonstrate that depending on the tools you have available, the students or athletes you have available to do these things, you can really kind of vary it according to what you feel as though you have the abilities to do. So I'm just going to go through first, and I think that an important thing is, as much as Dr. Murray pointed out so succinctly and Dr. Coker, that you do not want to have your child get an ACL injury, and at the same time, Greg pointed out that you can go through a program to develop in order to prevent this, which is pretty easy, the program itself. The athletes are already strong and flexible. It's still not being done. Most recently, I talked to a number of coaches and trainers over the last few weeks and just asked them kind of, off the record, are you doing an ACL prevention program now? And from Division I athlete colleges in the local area to Division I high school, Division II and III high schools, coaches and trainers, the multitude of them are still saying no, they do not actually do an ACL prevention program when they're training their athletes. They have their coaches go through dynamic warm-up. It's pretty much almost the coach running the program, and the athletic trainer really doesn't have that much follow-up as to what the coach is doing sport to sport, which is it's kind of scary, really, if we know that what money is spent and how everything is going on. So this picture down below is my older daughter, and I think, to be honest with you, I wasn't affected by this ACL prevention thing until you have a child in the sport, as much as you want to try to prevent injuries with all your athletes and all your players. But once you see your child on the field, you really want to try and develop it to the next level. The young lady, they've won the state title now 2 out of the last 3 years, and the girls that we did not have exposure to, who were 1 year older than my daughter's grade, that we started this program when they were in 6th grade, the girls that we did not have any overseeing of when they went to high school, 4 out of their grade tore their ACL, and the young ladies in my daughter's grade, only 1 has torn their ACL. So I think that there is some compelling evidence there. So jump assessment, we're going to come back to that afterwards. So here, developing the prevention program, the question is, what do you want to do? Is this something that you have an athlete, a patient, a son or a daughter? Well, if it is just a one-on-one situation, I think it makes it much easier for you to develop the program that you think they need, either through an evaluative tool or whether you think that you have the abilities to bring them to some place like the Micheli Center and be evaluated there by a more professional staff who can really point out those deficits. When you start to get into a team, and if you are a coach, if you're lucky enough to be the coach, then you can implement that time frame at the beginning of practice or the middle of practice, or however you want to do it. But when it starts getting to the school and the community, it turns out to be a much more political endeavor in terms of making people think that you're not doing it for a revenue standpoint, but you're actually truly in your heart of hearts trying to do it to prevent injuries. So I recommend, if you are a parent and you are a healthcare professional, go to these boards, go to these town meetings as a parent first and a healthcare professional second, and I think they'll let you in the door more readily to see that you're really genuinely concerned about your child. So what program do you really want to do? I mean, the kind of the gold standard programs over the last few years, and you can ask questions to us afterwards about them. Sports Metrics, which is Greg's program out in Cincinnati, from the PEP program of Mendelbaum out in California to the FIFA 11. The question is, what do you want to get out of the program, and have you looked into each program before you've implemented it? Most of the programs that I think everyone would say is complete, you'd go through the idea of strengthening, agility, jump training, balance, and flexibility. And when you have that presented in the whole, you would probably see better statistics and a stronger statistic to say that that helps to prevent injuries more than when you're missing some of the components. And again, as a physical therapist and an athletic trainer and a strength coach, there are other components that you're also trying to prevent also, such as patellofemoral, Osgood-Schlatter, Sievers, patellar tendonitis, and some of these programs have it all in there. So I think what you want to try to do is not just sell the idea that you're just trying to prevent an ACL injury from the age group of 14 to 17, because I think what you might do is you might miss some of the parents and some of the coaches thinking that it's important to do. So the question is, which group or which program is going to be best suited for you? Out of those, the sports metrics and the PEP program, it has a much greater level of flexibility, stretching in there than the FIFA 11. So, I mean, I think that the FIFA 11, it's promoted by the professionals, professional players, but actually when you look at the content of it, you see there isn't much stretching in there at all. And for younger athletes who are going through their growth years, if you are trying to make a change in some of the not devastating injuries such as ACLs, but the time frame injuries of Severs or Osgood-Schlatter's, it's much more important to also have a flexibility component in there also. So the variations, I highly recommend, you know, the thoughts that I have when I'm thinking about some of these injuries, going through it over the last 25 years. Greg Meyer's papers are just incredible in terms of bringing everything together. So within a few minutes of reading this paper of all the 14 studies, you read that the studies are very compelling, that many different things can work. But the big indicator is that you do want to have a professional overseeing what you're doing, because otherwise, if you do have a program out there and the kids are just jumping around, typically it's not going to be followed that well, or the statistics aren't going to be there to actually decrease the injuries. So when you look here, I mean, time frames of programs vary from 10 minutes to 90 minutes. Off-season, we do run a program through our therapy group, which is an off-season program, and it can take 60 to 90 minutes where kids come in and train that way. But that's not for everybody. Some people play 3 sports, so that the programs that are only for 10 minutes, well, if you can statistically show, gee, I can reduce ACL injuries with my athletes by doing a 10-minute program more than a 90-minute program, well, I think that you could say that that might be something that more people might want to follow. Will you really get a strength change in a 10-minute program? So some components of it, such as strengthening, is it more neuromuscular development training that you're going through with the 10-minute program, whereas strength training, really you have to put a little bit more time and effort in. So depending on how strong you want to make your athletes, you might have to do one of the off-season 90-minute programs if you're looking for more strength. So when we talked to the coaches, what were the coaches' excuses? And mainly the biggest thing was time taken up on the field. So when you tell a coach, whether it's a town community coach or a high school coach or a college coach, that this could take anywhere from 20 to 25 minutes, many coaches will say, I can't commit to that time frame. But when you bring it down to the 10-minute program, we got much better results in terms of people saying, okay, I think we can do that. They didn't know what the program consisted of. So, I mean, from the athletic training side, you know, I always say physical therapy is after the fact of the injury, and the athletic trainer is the person who identifies the injury beforehand. I think the athletic trainers probably do, and I don't know what capacity they can within their community, how much power the coaches have over the trainer, but having the trainer actually do more in regards to implementing what needs to be done. You can tell the athlete not to go back on the field. Well, maybe before you can tell the athlete to go on the field, they have to at least be qualified to do X amount of things before they get on the field. And then some of this ridiculous comments, kids don't get injured, little kids don't get injured, they don't need to do this. So how do you break into a town soccer league? Well, what we did is we went in and we kind of got a reaction from our town in Medfield, Mass, that the whole thing was that they didn't want to devote the time, and B, that the smaller kids, well, that's going to happen later during their teen years. So we went on the idea and we showed them through studies. The Brazilian study on Osgood-Schlatter was a good evidence-based study to show that Osgood-Schlatter is greatly reduced through stretching. So we went in and we showed them that this was the beginning program for the U7 and 8s, and what we did is we showed them doing a dynamic warm-up, doing your basic butt kickers, high steps, side-to-side shuffles, back pedal running, but more so at the younger age we were working on the flexibility of the Achilles and flexibility of the rectus femoris and the quad and the hamstring. People bought into say, okay, we could start that. So we got the coaches to say that they're going to do that at the beginning stage of the practice. And then once we got them up to the U9s and 10s, at the coaches meeting each year, we would go and we'd ask them to implement the next level, which would be for the older kids, which would be running cuts. So we started to do more agility training. Again, we still implemented the flexibility because, again, luckily the majority of injuries I see at that age are more the patellofemoral and tendinitises and the apophysitis is more than the ACLs, which is good. And then ultimately, after we did that, we got it to the point where at the U10, U14 level, with the dynamic warm-up, we started to add in more plyometrics, strength training, and looking to put an ability to strengthen their legs. So we kind of combined the plyometric and strengthening together on the field. And like I said, this group, my older daughter there, we had found that only 1 out of the whole grade in the soccer program tore their ACL, whereas the year before 4 did. So what we're trying to do is implement a program that will work, implement a program that the parents buy into, and ultimately implement a program that we think is best for the deficits that we see at hand. The one thing that Greg has the ability to do, which I think some of the high school and college and higher up levels have the ability to do, is take kids out, weed them out, and tell them that this one person needs individual care. But with our teams, we basically just ran it through the whole team, and then we suggested to parents on the side with the youth level that we thought might have some kind of deficit, that they could go to a place like the Micheli Center and be evaluated there for further training. And so far that's worked well. So only a few kids we could kind of pull off to the side, the parent afterwards, and kind of talk to them so we weren't singling that child out on the field. And again, this is the thing that it's interesting, is that when your budget is really bad, and most playgrounds in the area, we used to be hopscotch. The NSCA a few years back said you shouldn't do any plyometrics till you can squat 1.5 times your weight. But I think at this point now, it's come to the next level where we understand that young kids can do jumping and leaping exercises and activities, but they just need the right teaching by the healthcare professionals such as yourselves. So that is everything that I was going to talk about. But what I wanted to do, because I think we're really lucky to have Greg here from Cincinnati, is have him come up and assess Sophia. Don't hurt her.
This is Sophia. She's going to be our guinea pig. And Carl, if you come out here. It should be in the handout. There should be a touch-up assessment tool. Mark off most assessment. Sophia, have you done, did you show her a touch-up this? Has she done those before?
At practice, we do double knee plyometric.
Okay, so what we're going to do is we're going to have you go and see what you do. You're going to try to jump up, pull your thighs parallel, and land and do that repeatedly. Yeah. This is not really the test, but go ahead. I'll see if you can go. Yep. So do that repeatedly, but I want you to hit and go. So go quick. Pop it up. Pull your thighs parallel. So pull your thighs high. That's it. And just keep repeating it. No stop. There. Okay, time. So again, there's some important aspects. You can see the criteria in there. If I had time to show you videos of each deficit, but we're going to go through and see what her deficits are, see if we can pick them out in real time. But the important aspects of doing it, the important aspect of doing a screening is getting her set up correctly and getting the exercise correct. So we got to first make sure she can do the movement correctly before we can assess her with that tool. So one thing that we set them up is, I'll use this right here. She's going to be sitting on the outside. What if you have your athlete set up like this and they do their jumping? Is that going to be a problem for some of the risk factors we talked about? Why do you think so? You can't go into valgus, so I can't assess for valgus. So again, we set them up, and I'm going to have you start right here on the side of this box right here. So start right there. And I can tell you the way we set them up is we put a athletic tape down and a tee and their feet. We put them about 35 centimeters apart. Basically, to be shoulder width apart. Younger girls you can bring them, but I want some distance in between their feet when they start to jump. The instructions I gave you, I don't give a lot of instructions. If you have the ability to have a video to show them what the movement is, a lot of times kids don't know what movement. She was looking at me like, what are you talking about? So you got to get them to understand the movement. A video of the movement that you want is also a good idea when you're out screening athletes. So it saves time. I have a laptop watching the video of what they're supposed to do, so by the time they get to me, they know what at least I'm talking about. So what I'm going to instruct you to do, I want you to stand right there. I want you to jump just like you were, pulling your thighs parallel. So pull your thighs up, no pauses in between, really fast. You're going to do it for 10 seconds. All right? Wait till I tell you. I'm going to try to come down here to get a little bit better perspective. And then you guys have seen the tools that we're looking at. So the risk factors are listed, and we're going to kind of watch her as she goes. So you're going to go for 10 seconds. You ready to go? You can have your hand up to your side, relax wherever you want. Let's go, 10 seconds. Go ahead. Go. Hold up, quick. Keep going. Foam up, foam up, foam up. Keep going. Time. What do you guys think about that? She's not done this, or any deficits? Anything you saw? Yep. So let me turn her a little bit. She had a little bit of a staggered footprint, and she was kind of leading. The valgus wasn't bad. Did anyone see any bad valgus? No. So we're going to try it again. What I want you to do this time is I want to make sure you land on the same footprint. So I want you to just turn sideways. And basically, I want you to be right there, and I want you to watch the front of her toes. We'll see if she does it this time. Do the same thing for 10 seconds. Go ahead. Pull up, thighs parallel. Keep going. Time. So tell me what you think her biggest deficit is, based on what you have there, and I'll tell you what I think. Raise your hands if they say. Yeah, she's not getting her thighs up. And is that a big risk factor? I don't know, but that's not doing the test the way I want it done. So there's some things that are built in that criteria sheet so that I get the test right, so that I can do an adequate assessment. So I want you, what you're doing is you're kicking your butt when you jump. I want you to try it one more time, but I want you to face this again. And I want you kicking back your butt. Pull your thighs up parallel. 10 seconds. Go. Foam up. Foam up. Thighs up, thighs up, thighs up. Time. What do you guys think about that? To be honest, I think she's a little rock star. He brought something good. What would be the one you picked out? That was mine. Who said that? Raise your hand. I didn't see it. Who said it? All right there. I agree. So why is she too noisy? Why is it so loud? Landing with a flat foot. So when basically loud noise equals high ground reaction forces. I don't need a force plate to predict high ground reaction forces. She's landing with a flat foot. So what you're doing is you're landing with your foot too flat. You need to land on your toes to use that and anticipate the forces. That's our biggest deficit. Everything else would look pretty good. A lot of times athletes will stagger their feet. You'll see differences in that. What's it mean whenever you see an athlete who maybe they're coming back from ACL reconstruction and then land with one foot staggered like this? Which leg do you think had the ACL as a reconstructed leg? The front one or the back one? The front one. Basically, that's the way athletes cheat and unload that leg that's either hurting them. You shift it forward, all the ground reaction forces go to your other leg. That's why we see high second injury. Where do you think the second injury for ACL comes? Primary or the other leg? It's a contralateral. So what do athletes do? They come back, they tend to rely. That might be their non-dominant, they might be as good neuromuscular. They load that leg a lot more, they're not prepared for it. And basically that's where they have their second injury. So that's a common mistake that we make in our rehab when we turn our athletes. We need symmetry. So a lot of things you see on that assessment tool are symmetry related. So we want to see them land at the same time. Why do you want to see them land at the same time? Their feet. Why is that important? Good for the hips, but it's also showing you that the ground reaction forces are being dissipated equally. If you land on one side before the other, that's another way that athletes protect their legs. So they may be landing with their feet parallel, but if this foot's landing first, that one's getting about 90% of the ground reaction forces. So it's an important aspect. But I thought Carl had a great point about can young kids do these type of jumping activities. If a kid's running and jumping and playing, is that plyometric training? What do you think of running is? It's a repeated single-leg plyometrics. So when athletes play, when they land from a jump, they can land anywhere from 8 to 10 times their body weight. So how much do you weigh? 80 pounds. So she could be hitting the ground. When she lands, she could be hitting the ground 800 times body weight, or normal. So could we teach her better mechanics so she can dissipate force and reduce those? Is that a bad thing to train with exercises? I don't think so, because kids naturally play with high loads. So that's an important aspect. Carl, do you have any other things that you would point out with her technique that you want to add?
No, I think I think we've been doing it now for the last 2 seasons with her, but on the grass, we haven't promoted the high knees as much as, is just making sure that they're not landing with a valgus moment. So that's something we can work on.
I can tell you that this is not the norm. Most of your young female athletes could do the repeat jump. So they'll do one, another stop, and pull it up here to build up from two. That's really good for starters. I mean, you can tell that Carl's been working with her, and she's a little stud athlete. So great job. Thank you, Sophie.